Hello, this is Vincent Obita here, and today we are going to cover evaluation of a patient with neurological impairment, and that is GCS patient in Osce. And the new test of competency, this session covers 10 minutes, and you are supposed to give an oral submission, which you will be directing to the assessor, simulating a handover of care of a patient from one caregiver to the next using the Sbar technique, that is situation, background information, assessment, and recommendation. All these aspects will give a quick guidance for the next carer on what exactly they need to do for this patient. All this submission will be relating to the scenario you are given, what you've covered in your assessment, what you've covered in your care plan, and what you've covered in your implementation, all packaged in the four category of the Sbar. And your oral submission, you need not to talk like 10 minutes, but you ought to plan and deliver all your submissions within the 10 minutes period. So you can jot some guidance on the paper you will be provided with, what you need to cover for the situation, for the background, for the assessment, and for your recommendation. All this only just need to fall in the next within the next 10 minutes. Now, your oral submission may take this format. My name is Vincent Obita, one of the staff nurses in the acute medical unit, and I'm going to give you an end of shift report of Joseph Smith, date of birth 20th of December 1972, who was admitted today and is currently in Bay 3, bed 3. Now, that covers the situation. The background information will entail Joseph Smith was admitted today due to low level of consciousness following a fall in the bathtub that occurred this morning. His past medical history revolved around he has a stroke and is also having atrial fibrillation. Is normally on edoxaban and atorvastatin. He had a stroke in 2010. Is normally mobile with a stick, and he takes alcohol socially and is also a smoker. He lives with the wife, and he has been having confusion since he had the fall this morning. That covers the background. In terms of assessment, the observation, he has a respiratory rate of 16. The oxygen levels are 98. The blood pressure is 138/68. The pulse rate is 66, and the temperature is 36.6. He has a Glasgow Coma scale of 14/15, as he has been presenting with confusion. During his admission, he had a CT scan which showed hematoma, which has been reviewed and is currently managed conservatively. Is currently nursed in bed and is at great risk of fall due to being unsteadiness and also the confusion. He needs assistance of one with activities of daily living, and the major concern for this patient is just the reduced level of consciousness. That will cover your assessment. In terms of recommendation, I would recommend 4-hourly observation of vital signs for Joseph with a 30 minutes observation of the neurological assessment every 30 minutes, and to be escalated to the medical team should there be any deviation. Also, due to the reduced level of consciousness, I would recommend Joseph to be referred to the neurological team to ensure that all his neurological aspects are covered. And with that one, you cover all the recommendations that you need to give to this patient. And as you can see, in under 6 minutes, you've covered the 4 aspects. That means that you ought to have like some minutes to jot down what you really need to capture. You can keep reference on both your documentation in assessment, care plan implementation, as well as the scenario booklet, because it has all the information relating to the reason of admission, past medical history. Those will be too significant in the background information part of the Sbar. So don't restrict yourself to what you've just done. Also capture all that you are given in the scenario. All this you can only do when you practice a lot on how to fetch information from the scenario booklet, the one you are usually given to read for the 5 minutes, and also the things you've done. Remember, when you will be presenting your assessment, you will be covering the vital signs and all that. You can lift all that into your evaluation, okay, including the medication that you had administered during your implementation. With all that covered, you would have given a detailed handover to the next person. At the same time, you can keep reference to this booklet you've talked about. That you've noted out onto what you are going to talk about, because anyway, you are giving a report and it ought to be detailed and cover all that you are planning to pass to the next person. No offense in keeping reference to that. The only thing you need to do, ensure you've covered all those elements and the next person is able to continue that care safely. Thank you so much, and continue subscribing, continue looking out for more videos. For those who are taking their Osce soon, we wish you all the best. It's all doable, and I'm really grateful to those who keep on sending messages of their passing. And welcome to Band 5. That's all we can give to you. Thank you so much, and until next time, take care. Bye.